All right, I love it. Well, let's go to number five. I think that we're on a roll, and I think that if we were talking game show, we would say that you can always phone a friend. That if you have to call for help, you can do that. Number five is if you don't know what a drug or product or chemical is, you can always ask. And I think that's great. Even the internet pill identifiers. I'll grab some just common things around and do a scenario at the college here in Galveston, and students now being very internet savvy and knowing what's out there will go right to the pill identifier. Others not so much, but there are a lot of ways that you can get help. I mean, a lot of ways.
Tremendous number of ways. There are all sorts of automated data sources. I love my smartphone. It's my peripheral brain. I store a lot of information in it. In addition to pill identifiers, there are programs that can help us with chemical or radiological exposures like CHEM and REM. These are downloadable for free. There are resources like the National Response Guidebook that can help us identify numbers on placards. And if we've forgotten it, can help us decode placard symbols so that we know what the hazards are to ourselves as rescuers and to our patients. Another great source of information that we alluded to earlier is your regional poison center.
Yeah.
Anywhere in the United States, you can reach a specialist in poison information or a medical toxicologist like myself by calling 1-800-222-1222. And they'll
That
be
number again.
yeah. 1-800-222-1222. And there are tremendous
Operators are standing by.
24/7 all across the country. You might have local hazmat resources for large events or large scale events or scary events that we think might be terrorist events. There are local and state emergency management agencies, response teams like hazmat teams, our National Guard with their civil support teams has been instrumental in helping us with some challenging cases in the past. So those are great resources for you. In fact, we mentioned things like CAS numbers and EPA registration numbers. Those are available online as well. There are a number of databases. You can download one, toss it on your phone, or actually just look them up as long as you have internet access. As we mentioned too, then, if you have a brand name, try to get the whole product name with it. The brand name alone is not often that helpful to us.
Would you say if you found a bunch of things now, if you've got RAID, you've got other stuff, certainly hazardous stuff. We obviously don't want to bring bad stuff to the hospital, but we could snap photos of it, right? We could take smartphone
Absolutely.
photos.
Absolutely. Yeah, and there are sometimes the containers are huge, unwieldy, bags
Right.
of fertilizer or things that should be picked up by hazmat that you don't want to bring. Photos are awesome.
And I think the other thing that I see I read through all of these seven things before we did this, but as we talk about it, more and more comes to mind. The thing that comes to mind is that a lot of the things we talk about, the methyl ethyl bad stuff and all this, we think about them as large scale incidents. But all the material safety the status sheets and we think about those for big things. But when you have a single patient that has a toxicological emergency, that same information goes for small scale things too. I think we sometimes just forget about the scale of these things.
Absolutely. Things like safety data sheets can be used for an individual exposure just as easily as a mass exposure. A quick word about safety data sheets. These are available online as well, and they're tied to specific products. The quality of data that we're going to get as care providers can be really variable, though, depending on who constructed a safety data sheet. Sometimes these are put together by chemists, and they're really good at communicating physical and chemical properties, hazards that are associated with a particular agent. But they may not be very good at getting beyond basic first aid. And on the other hand, if we have a safety data sheet that's put together with a healthcare provider or from a healthcare provider's point of view, the first aid information and maybe even information about antidotal therapy is likely to be of higher quality. So your search may not end with a safety data sheet, but it's always good to grab one if it's available because it helps us to identify a very specific product. Folks at the Poison Center can take it a step further for you if you need some help researching those agents.